Well, hello and welcome to today's episode of Breaking the Taboo. And this week, you may be aware it's Birth Trauma Awareness Week, which has been organised by the fantastic charity, the Birth Trauma Association. And so in honour of this week, where we talk all about birth trauma, I've decided to do a special episode on life after birth trauma and what it's like for mums who've lived with significant mental and physical health challenges post-birth. So I'm delighted to have with me today on the episode to discuss this two experts and affected mum as well. And the first is Leena Savjani, who is a partner at the national law firm Irwin Mitchell. And she's a specialist in medical negligence law with over 19 years of experience in the field. She's acted on some of the most complex and sensitive cases in the field, often involving serious injury and systematic failings in healthcare. She's got a particular expertise in maternal injury cases, particularly those involving obstetric anal sphincter injuries. And I also have with me Ailsa Adams, who is a mother of three, including some twins, who experienced a severe birth injury known as an obstetric anal sphincter injury during her second delivery in 2020. And the repair surgery that she underwent immediately after birth was found to have been inadequately performed, leaving her with physical and mental challenges that have impacted every aspect of her life. And she went on to develop colostomy surgery as part of her ongoing recovery. And something we'll talk about in the episode today is navigating life post-OASI and how complex it is and how to get guidance for mothers facing similar challenges. Ailsa works as a physiotherapist for the NHS and now lives in Scotland with her husband and her children. Well, I'm delighted to welcome you both to the studio today to discuss this important subject. And I was really keen to talk about this because over the last few weeks on series 2 of Breaking the Taboo, we've been reading the many comments that have been coming in from listeners. And I've had so many questions about things that are really practical, like how to request your birth debrief, getting access to your medical records, and really some sort of practical advice for other mums who are also living with a birth injury. So I hope today will be a really, practical and useful episode for listeners of the show. So perhaps, Leena, if we could start there with anyone who's less familiar with birth injuries, what are they and what are the types of things that we're talking about?
A birth injury can occur either to mum or baby, and in the specific context of mums, that could be anything from perineal tears, pelvic floor damage, injuries to the coccyx or pubic bone. It could be a postpartum hemorrhage. So essentially, any injury that has occurred during childbirth. And in the instances of babies, it could be hypoxic injuries to babies where they've been born in poor condition as a consequence of a traumatic birth. So in summary, that's how I would define a birth injury.
That's really helpful. And I think to sort of give some context for listeners, I always like to have some personal testimony from an affected mum. So Ailsa, thank you so much for coming on today's show. It's really brave to talk about your personal experience. So would you mind sharing with listeners what happened to you when you sadly suffered from your own traumatic birth?
Of course, thanks, Theo. My birth was already going to be challenging because my pregnancy was on the background of COVID. So COVID was ongoing at the time. And I was obviously aware that I was going to be giving birth to twins. So when I first telephoned the hospital, when I woke up early in the morning and my waters had broken, unfortunately, I believe that I was given incorrect advice. I was sort of told to stay at home. It wasn't an emergency, and to have a shower. I believe that the advice most likely should have been for me to attend the hospital, given that I was having twins. When I attended triage, because of COVID, my husband wasn't allowed into that department. I, came in and told them I'm the woman who'd phoned, I'm having twins. And they proceeded to ignore me for half an hour as I laboured in the reception area. There was a lot of hustle and bustle going around, and me being me, I just thought, well, there must be more priority patients here, and I just need to wait my turn. I did manage to grab their attention, and I think they'd realised by that point that I was quite far through my labour and I was to be sent straight to the labour ward. Unfortunately, when I got to the labour ward, my first midwife, she didn't assess me or my twins. She was extremely concerned that they hadn't given me a name label and they hadn't completed my bloods at that point. I think her focus was just purely on that. And I think going back and reflecting, if she had assessed my twins, there would have been more time for me to make an informed decision about how my birth progressed. So it was quite near the end of shift change. When the shift change happened, the second midwife on the labour ward, she went to assess the twins and realised that one of them was struggling, and that's when they called the doctors. I was assessed and I was found to be 9 to 10 centimetres dilated, so I'd obviously gotten to that point pretty quickly. There was a lot of concern in the room about the twin who was in distress, who they label twins twin 1 and twin 2. So twin 1 is the baby that you'll deliver first. Twin 2 is most likely the one that's sitting higher. So he was twin 2. So he was, obviously had someone who was blocking his way out already. So there was a lot of distress in the room, and I was taken through to theatre. And at that point, I was informed that it was too late to have a C-section, and that it would have to be forceps delivery. I think this is something that many women aren't really informed about, that actually labour can progress to a point where it's very unsafe to go back and have a C-section, that the baby's lying too low. So that was my options. And of course, listening to the medical professionals who were assisting me, I had to go with that option. Although reflecting back, the options weren't really given to me in a way that described the pros and cons, and my consent form for forceps delivery actually remains unsigned. So following the delivery, one of my twins, he unfortunately required resuscitation. So the second twin, who we already knew was having difficulties during the birth. So all of that was going on in the background. However, I'd suffered a tear to my anal sphincters, as Leena has described. The consultant described the tear to me as a small tear to my bottom, and that I would be given antibiotics, stool softeners, and it would heal given time. I really do feel that it wasn't explained to me at that point exactly what had happened to me. A small tear, I feel, really made the whole injury quite insignificant. I almost had in my mind, like, oh, this is just a small tear, I'll be able to get over this, I'll just do lots and lots of physio. When in actual fact, later down the line, when I've had more testing done, I suffered a very large and severe tear. In the notes, it describes me being stitched up for around 30 minutes. My understanding of a very severe tear, it would take much longer to ensure that everything was stitched up properly and brought together again. So overall, a very difficult and traumatic experience.
Yeah, well, Ailsa, thank you so much, firstly, for sharing your story. You're really brave to come on the show to do so. But I think it helps so many mums who write into me to say they feel less alone, so that if it's happened to them too, that they know other mums have been through the experience and have had help with their physical and mental health recovery post-birth. And I relate to so much what you said, because I suffered a 3rd degree tear myself. And to be honest, I had really no understanding of birth injuries before I had my own. Certainly wasn't something that was covered in antenatal classes or any education. And Ailsa, it's clear that you've been obviously told a lot about what happened to you now, so that you're much better informed about what happened in that emergency situation. And what I'd really like to talk today about is giving some mums some sort of practical resources. So were you offered a birth debrief or sort of birth reflections afterwards to understand what had happened to you during labour and the childbirth?
Because my situation had happened during COVID, there were quite a lot of unfortunate places where I'd slipped through the normal pathways of care. So my 6-week obstetrician appointment was missed off, and they they've told me that this was due to computer error. I was being seen at the time by a physio, and I think she recognised the fact that things weren't going well for me, both physically and mentally. And at that point, she suggested that I would have a birth debrief. So yeah, I went, or it was over the phone, being COVID, went on to have a birth reflection a few months following the delivery. Unfortunately, the midwife who carried out that birth debrief hadn't been the midwife that was involved in my care. My notes were particularly sparse, they lacked detail, and she wasn't really able to answer many of the questions that I had. I feel very strongly now that, given that experience, that for complex births that end up in injury, that they should really include the team that were involved in the care. And also it would be ideal to really have someone independent in the room to be able to make sure that both voices are heard from one side and the other to give a balanced picture. However, as I said, that my birth reflection didn't adequately answer my questions, so I decided at that point that I wanted to make a formal complaint through the PALS service at my hospital.
Okay, maybe we'll get onto that a bit later in the show, but if we could just stick with birth debriefs for a moment. I'm sorry to hear, Ailsa, that you didn't have a good experience. I was able to request one, but Leena, a lot of mums listening to the show won't know what this service is, and they certainly won't know how to go about requesting it. So could you just explain to listeners what is a birth debrief and how should they go about requesting one?
Yeah, sure. So a birth debrief often is the first step for most women in making sense of what's happened during a particularly traumatic birth. Essentially, if a woman has suffered a traumatic or complicated birth, or even if it's not been particularly traumatic, but a woman has just felt like things didn't play out in the way she'd expected, she's entitled to ask for a birth debrief. As Ailsa said, sometimes it's referred to as a birth reflections, and typically it would be with a midwife, but it can also be with an obstetrician. And again, as Ailsa said, ideally you want to involve the team that were involved in your particular birth, but also perhaps to have a senior midwife or somebody independent there if possible. What's really important with any birth debrief is most midwives who conduct these debriefs have had specific training in providing birth debriefs, because it needs to be delivered in a way that feels supportive and transparent. Because if it doesn't, it can often actually have a sort of be counterproductive and can deepen the trauma for many women. But essentially what it is it's an opportunity to walk through your medical notes with a midwife and begin to understand the sequence of events. Essentially, it's an opportunity to ask questions, have them answered, but it's also a safe space to process emotions and really get an understanding of what's happened and potentially identify areas where perhaps things could have been improved. It's a two-way process, primarily for the woman, for the mum, but it's also a feedback process for the team that were involved in your birth and delivery, which can then be used to improve future maternity services.
That's really helpful. And I remember when I had mine, it was so helpful to go through the timeline of what happened to me during labour, because I had such a long labour of kind of several days that I was in hospital. And I think when we're in that very distressing context and in a lot of pain with contractions, it's very hard to remember like what the sequencing was of medication you were given and other things. So bearing in mind, for anyone listening to the show, you absolutely don't have to have it, but our point is to please request it if you would like so. And with my kind of politician hat on, that's something I've been campaigning for, is to make sure that it's a universal service. And I've been asking the Health Secretary to roll it out across the country so that all of you have access to it in all NHS trusts. And Ailsa, if I could just go back to you, you talked about obviously being told that you had what was now, you discovered a very significant birth injury. And presumably, like me, that was not something you knew much about before your twins arrived. So how did you go about finding access to information or resources to help you with your birth injury?
Being a physiotherapist, I was quite aware of birth injuries. I think there are some gaps in my knowledge that I had before I went into labour. And I think this came from the fact that when I had actually done a placement as a student in women's health, that all the women who we worked with had actually got better. And unfortunately for me, I now know that my injury wasn't adequately repaired, and therefore I wasn't getting better despite doing everything that I should have done. Getting support after having a birth injury can be really, really challenging. I felt that at times I wasn't really led to believe that there was a particular pathway for a woman who'd had my particular injury. Many of the health professionals I come across were also under the impression that if I must have had a repair done properly and therefore I would inevitably get better. When I attended and finally got an appointment with a gynecological expert, and she kind of took one brief look at me and said, "Oh, you'll need colorectal opinion on this." I was sort of led to believe that I needed to stay within the system, within my local hospital. I had quite a few different delays to that process. So firstly, I was referred to a colorectal specialist. However, I ended up being seen by a general registrar, so a general surgical registrar, who apologised but wasn't able to provide me with the care and to send me down the pathway that was required. I then ended up going back for another appointment. I was seen by a colorectal registrar who also wasn't aware of the type of injuries that I'd had and therefore wasn't able to guide me. But at this point, I'd done my own research. I had researched particularly on the MASIC website. So MASIC is a charity specifically for women who have had anal sphincter injuries during childbirth. And they have some really good resources to try and point women in direction of surgeons who have the knowledge and skills to be able to assess and decide whether a surgical option is possible for you. I also had support network that I tried to pull upon. So my husband, family, friends, my church community, and later on down the line when I was making decisions around whether to get a colostomy or not, Colostomy UK have some really good resources. First, for my own understanding, being able to trial having a stoma fixed to your front and the bag full of something and being able to trust that feeling that it's not going to leak. And also for my children as well, they provided some really good resources to be able to explain to my children what surgery I was going to have, how it would look, how mummy was going to go to the toilet in a different way.
That's so helpful. And for anyone listening to the show who's not come across those charity resources before, MASIC is a really fantastic charity that helps mum with birth injuries. And if you'd like to go back to series 1, we have a special episode with their chief executive who came on the show to talk with another mum. So do check that out if you haven't listened to that earlier episode. Well, Ailsa, I'm so pleased that you mentioned MASIC. And could you tell listeners a bit more about the services that they offered you?
Apart from just the online resources, I was able to link it in for some peer support. So I had a peer supporter and still do have a peer supporter called Jo Prance, who is a trustee at MASIC. And she herself had a traumatic birth in her early 20s, had a multitude of different surgeries and went on to have a colostomy fitted. And she was able to give me a personal perspective as to how a colostomy surgery had changed her life. It isn't for everyone. However, it was so helpful to kind of hear firsthand how she'd managed and how she'd come to the conclusion that that was the best way forward for her.
And I think you make a really important point there, that I think listening to other mums who've had a similar experience and hearing from them is so helpful. I remember we had Jill Castle, who famously swam the channel with a stoma bag, the first person in history to do so, came on the show to talk about it. And I'm so pleased that we are talking about this openly, because the whole point of this show is to break the taboo by speaking about the things that people don't. And if we could just turn onto a different topic for a moment. Leena, Ailsa mentioned there that she did have to make a complaint to hospital, and she mentioned PALS. A lot of people won't know what that is. So could you just say what is the support that they offer and what is it?
Yeah, sure. So PAL stands for Patient Advice and Liaison Service. And generally speaking, it's intended to be a patient's first port of call for raising concerns while they're in hospital in a more kind of informal, supportive way. So usually you would have a PAL's office in every hospital, in every NHS trust. And the way they operate is that they are a bridge between the patient and the clinical team. So you can talk to them, for example, for things like arranging a birth debrief, or you can talk to them just generally about concerns you've got, either in relation to the treatment you have just had or in relation to ongoing treatment while you're in hospital. And you can also talk to them about raising formal concerns and how you go about doing that and how a formal complaints process works. So how I usually describe it to people is that PALS is a good place to start if you want to try and get things resolved immediately without making a formal complaint. And I would say think of them as your advocates within the hospital. They're basically a team of people that are there to listen, explain, and help you move things forward.
That's really helpful. And if we could just get onto the sort of mechanics of making a complaint, how do mums actually go about doing that? What's the time frame for replies if they're not happy with the service that they've received? What are the kind of next steps that they should do?
Sure. So, I mean, the first thing I would say is that as a mum, you've absolutely got a right to raise concerns, and making a complaint isn't about blame. It's simply about answers and accountability. So you are perfectly entitled to ask questions, and the trust are obliged to give you answers. Usually, you have 12 months from the date of the incident to make a complaint, or from when you first became aware of an issue. That's the usual timescale, although trusts can exercise their discretion and respond to complaints outside that time frame. So if you are past that 12-month point, don't worry too much. It's still worth reaching out to the complaints team and asking them if they will consider your complaint. You can usually find a trust's complaint process on their website. Usually they have information available in their waiting rooms, or if you're still in hospital, you can ask a member of staff to give you a leaflet on their complaints process. But what I would recommend people do is essentially a complaint letter, and ideally, you don't always have to, but ideally you want to set out a formal complaint in writing. And the way you would structure it is you would set out what happened, and I would recommend people set that out in a very concise, chronological way to the best of your recollection, because I appreciate that for the reasons we've just talked about, your birth may have been very traumatic and your memory might be hazy about dates, times, and that's fine. Set out your version of events in your own words, but keep it concise. And then you need to explain why you're unhappy, what specific concerns you have. And then if you've got specific questions, I would itemize every question you have. As a conclusion, I would say set out what you want to see. What's your expected outcome from the complaint? Is it just the answers to your questions, or do you want a further explanation? Would you like an apology, or are you looking for service improvement, or all of the above? So have a think about what your intended objective is. And then once you've sent that complaint off, and generally speaking, the complaints can be emailed, usually you would expect it to be acknowledged within a few days. So you should get an acknowledgement within about 2 to 3 working days. But the actual response can often take several months because the trust will have to investigate your complaint, speak to the clinicians involved. It's usually good practice, and I always say to people that usually the trust will respond to you and give you an estimated time frame for response, which, as I say, can be a few months and sometimes can take longer, but they are required to communicate with you. So if the complaint is going to take longer than anticipated, they should reach out to you and let you know how much longer. And then ultimately, once you've received the response, if you remain dissatisfied, then you have the option to escalate that complaint to the Parliamentary and Health Service Ombudsman if you want to. The only other thing I'd mention, Theo, is that with some complaints, if you haven't had a birth debrief, or even if you have, the trust may suggest having a meeting with you to understand your concerns better. And for some women, that's really helpful, and they're happy to meet with the relevant team to talk through their complaint. And for some women, they don't want to do that. And that's absolutely fine. So it's completely optional whether or not, if you're offered a meeting, you decide to take the trust up on that offer.
That's really helpful practical advice. And something you just said earlier, Leena, was to obviously write down your story of what you remember. But obviously it's incredibly difficult also to remember what happened to you exactly during birth. So presumably a lot of mums will need to request their medical records as a kind of like a memory prompt. So how do they go about getting a copy of those?
Sure. So what I would say is that for the purposes of making a complaint, if you would like to look at your medical records, then absolutely request them and cross-reference them with your own version of events. But what I would say, Theo, is that they're not essential, because your experience of your birth is what it is, and whatever your recollection is, it's sufficient to set down what you recall, because as part of their investigation, the trust will look at a woman's medical records when responding. So it's not absolutely essential, but if you would prefer to look at your own records, then you are entitled to access your records under the UK GDPR regulations, which is the General Data Protection Regulations, which basically give you the right to make what's called a subject access request. So essentially, you can make a request for your own medical records. It's free. And then the trust or healthcare provider need to provide you with your records within 30 days. You're entitled to a full set of your medical records. If you want to limit your request to certain things, you can. But essentially, you would want your maternity notes. You may want your scans. You may want the CTG trace of the baby's heart rate. You might want the surgical notes and post-natal follow-up records. Generally, I recommend that if you're asking for your medical records, then just ask for a full copy of everything. Previously, records used to be provided in hard copy format. Now they're provided digitally. So it's quite easy for the trust to send you your records digitally using an encrypted platform where you can download them. And the other thing I would say is that you don't have to give a reason for requesting your records. They're your records. You're entitled to ask for them, and the trust are required to provide them. So it would generally entail a simple letter with your address, date of birth, etc., signed by you, asking for a copy. If the trust have a specific form of authority that they require you to complete, then they will send you that. You complete that, and then they will process the request.
That's really helpful. And I've had so many mums who've asked me that question on social media. So that's really good advice. And what strikes me listening to both of you is about the importance of self-education for mums. I just think so many of us who have a baby, particularly it's your first baby, like myself, you just don't know this stuff before you have a baby. And you only really find out when something's gone wrong and you start answering the question. And something we haven't talked about yet, Ailsa, is we've talked a bit about birth injuries. But I know that you've also spoken about access to perinatal mental health services, and we know that they're not standard across the country. But did you have any help for your mental health, given the huge challenges of what you were going through after birth?
Yes, I did, but it did take me quite a while to be able to access that. So I'll just give like a bit of a description about where my mind was at after I'd had the babies. So once I'd had the traumatic delivery, initially it was so difficult. I almost didn't want to think about it. I had twins and a toddler to look after, and I needed to get on with things. I did my best to, engage with physio and do as much of the recovery and healing process that had been, the advice had been provided to me to follow that. However, I really started blaming myself for what had happened. And unfortunately, I had several comments from different health professionals that really fed into that narrative. So I had someone say to me, you paid the ultimate price for having your twins naturally, because obviously when you're having twins, there's the option to have a C-section. You must have put too much pressure on your stitches. Shouldn't you have had a C-section? So all of this was feeding into it. I had a few instances as well where professionals were almost gaslighting me over what I was experiencing. I had a very thick stitch that was sticking out, and it, if I had been repaired correctly, that would have been impossible. And I was told that was impossible. However, as I hadn't been repaired correctly, it very much was possible. And a nurse at my GP practice was also able to palpate that stitch. I became almost obsessional trying to find an answer to the problem, trying to find an answer to help make myself sort of cured of the problems that I was having post injury. I started to read research articles because I'm a health professional. I know how to read a research article. And unfortunately, I was doing this, I put my toddler down to sleep in the afternoon. I breastfeed my twins to sleep. And then I would, instead of resting, I was obsessionally reading research articles, trying to find an answer. And of course, each research article leads to another and another. I did so much physio. I was becoming obsessional about that as well. I was doing 45 minutes to 60 minutes of physio a day, desperate, trying to help myself. I constantly replayed the birth back to myself. I picking out what I'd said and what I'd done. Had I said something different, would it have changed things? If I'd known this, if I'd been better prepared, perhaps things would have been different and I would have had a different outcome. I felt completely distracted all the time. I couldn't enjoy my motherhood. All I could think about was what was my bowels going to do next, because obviously I had issues with my bowels following my injury. I avoided certain situations, conversations, TV programs. I absolutely hated driving. I was having very vivid flashbacks of the birth, and I just felt like I was going to have a flashback while I was driving, and I didn't want to put anyone else in danger. In terms of getting help for the issues that I was having, unfortunately, I wasn't picked up very quickly by the perinatal services, and I think there was actually a new perinatal service that emerged whilst I was waiting. So I had a very kind advanced nurse practitioner in my GP practice who was checking in on me because she knew that I was waiting this significant period of time, and she actually identified this new service that had been set up, and I was picked up by them. So it was around a year after the birth before I actually got the mental health support that I required. And at that point, I was diagnosed with PTSD. All the symptoms above that I described that I was having all sort of constitute to this PTSD diagnosis. And it did help me make sense of what had happened to me, and also, I guess, why I was reacting in such a way. But because I still had these ongoing physical symptoms, and it wasn't until I got help further down the line by a specialist hospital and consultant where these physical symptoms improved, and I was having, and by that I mean I ended up having a colostomy surgery to be able to control my bowel symptoms, that I've been at a point where I can actually start to think about addressing the PTSD and the self-blame. I think in terms of having a baby and having an injury, it's complete oxymoron. It's one of the best days of your life. I think back and I think, yes, it was one of the best days of my life having my twins, but at the same time, it is one of the worst days of your life. It's so hard to disassociate the two. I totally love my twins, but obviously their birth caused a complete disruption to me, my body, my physical health and my mental health. And into that plays a lot of guilt. And of course, I know a lot of other women feel this as well, that birthdays are particularly hard. You wouldn't ever celebrate if you had a significant sort of road traffic accident or injury on a day. However, when you obviously have an injury that happened on the same day as your children's birth, it becomes a very difficult thing to kind of cope with in your head.
Well, I related to so much of what you were just saying, Ailsa. I mean, I remember my daughter's first birthday. I really didn't celebrate. She didn't have a party with her friends for exactly the same reason, that I now realise that I didn't really want to be focusing and dwelling on the day, as you said, 1 year on from what had happened to me. And I wrote as well in my book, Breaking the Taboo, about some of the perinatal OCD symptoms that you just described, that I had very similar as well following my birth injury experience. And if anyone is interested in having access to mental health services, then do listen to our earlier episode in the series where we spoke to a psychiatrist, and she talks about the different types of therapy options available to you. So do check out that episode in series 1. And Ailsa, you mentioned as well about you having repair surgery. that's not something we've talked about yet on Breaking the Taboo. So could you just explain what that is and what were the kind of options that you were offered? So other mums who are thinking of doing the same know a bit more about what to expect.
Yeah, so eventually I sort of went through my GP to get a referral to a specialist hospital because I felt like I was sort of led along by the hospital that I needed to get certain opinions. But on reflection, really, I could have just gone to my GP and asked for that referral. In the meantime, I was trying out lots of different conservative management treatments for the bowel symptoms that I was having. So, as I mentioned before, a lot of physiotherapy. I was described as an A-star student by my physio because I just really, really wanted to make physio work for me. But unfortunately, because I'd had this injury, it hadn't been repaired adequately, it was unlikely that was ever going to work. Biofeedback, I had electrical stimulation, I tried anal plugs to try and there's specialist medical anal plugs that can help to sort of stave off the feeling of needing the toilet and physically plug the your bottom. Irrigation was something else that I tried, and also suppositories. But I think I quickly realised that none of these things were helping me. I was still having a lot of episodes of fecal incontinence, and to try and avoid those fecal incontinent episodes through the day, I had this massive bowel routine in the morning, and it was really eating up my morning routine, which wasn't easy given that I had a toddler and twins to get up and going in the morning. When I finally got my specialist opinion, which was I think two years on from the birth, one of the surgeries that was offered to me was sacral nerve stimulation. So this is a device that is surgically implanted, and it works by sending electrical impulses to the sacral nerves. In some cases, it can really help women. Obviously, a lot of women have nerve damage in that area. So if it's mainly the nerves that have been damaged, then I think that's in those cases that's where it helps the most. But unfortunately, I didn't feel any significant benefit from this. So as I mentioned earlier, that's when I started to look around options, whether I consider having a colostomy at the same time as having a repair. And that's when I spoke a lot to Joe Prance from MASIC about my options. I was given counselling from a stoma nurse as well to give me a really realistic idea of what life would be like having the stoma. So in my case, it was sort of have the repair surgery to bring the muscles together and see whether we can improve things for you, but at the same time have a stoma to divert feces away from that area to help with the healing, but that if I felt ongoing the stoma was the correct option for me, I could decide to not have it reversed. So for me, I think I really realised that I needed to seriously consider a stoma because I just felt so anxious going into any sort of unpredictable environment. So my profession would put me into situations like that. I also enjoyed swimming before I had my injury, hill walking, just being able to not have to think about my bowels when I was wanting to experience those things I enjoyed before with my own children. And that's really when I made the decision that I would go forward. And I guess for me, the bonus point of having a repair meant that I also would get my anatomy back. Unfortunately, when I had the inadequate repair immediately post birth injury, I'd ended up with an extremely short perineum, and I think it really does affect you as a female. It makes you feel like your anatomy has been completely disrupted, and that was one of my huge things. I wanted to make sure that I look and felt the same way as I did before.
Well, thank you for being really brave and sharing that really personal experience, Ailsa. And what you said relates to so many of the stories that I read in the birth trauma inquiry in Parliament. And we heard some really shocking stories from mums like yourself who'd had forceps delivery, who, as you said, has really significantly altered their entire physical state post-birth, and it's very difficult to live with those symptoms. But I hope anyone listening to the show who's got similar symptoms, please don't feel shame or stigma about it. Please do ask for help. There are some wonderful organisations out there that will be in the show notes that we can direct you to, like MASIC, to get help. And just as we go towards the end of the episode, Leena, obviously I think it's really important to say to listeners, what happened to myself and Ailsa and others is still the very small proportion of births. A lot of you are going to go on to have a good experience in hospital and give birth to a healthy baby and go home with none of the symptoms that we're describing today. But in the sad and unfortunate incidences that that's not the case, and that they do want to possibly speak to someone to get legal advice, Leena, what would you recommend they do to get a specialist in to point them in the right direction?
So as you said, Theo, birth injuries are a very small proportion of the overall births that we see. But if you feel something went seriously wrong and you have had a birth debrief, you've spoken to pals, you've made a complaint, but you still remain dissatisfied, then you may want to consider getting specialist advice. Not all birth injuries lead to legal claims, but for anyone listening that feels something wasn't right, or they're just not getting the answers they need, then I would encourage you to seek the support that's available. As I say, your first port of call should always be PALS, formal complaint. But if you're still left with questions and you're wondering whether there might have been negligence, then you don't have to figure that out alone. You can speak to an independent charity called AVMA. So AVMA stands for Action Against Medical Accidents. They run a really great free helpline. And in fact, you can also call them if you're at a very early stage and you're going through a complaints process. So they're very, very, very helpful. And they can provide lots of guidance on next steps. And they can also help you find a lawyer who specialises in this kind of work. Another great organisation you might want to consider talking to or having a look on their website, and I know it's been mentioned on your podcast before, Theo, is Birthrights. They offer free legal advice by email, especially around issues like informed consent, decision making in labour, and respect for maternity care. And then if you do decide to speak to a lawyer, it's really important to go to somebody who specialises in clinical negligence. So you can search for an accredited solicitor on the AVMA website. There's also an organisation called APIL, which stands for the Association of Personal Injury Lawyers. And again, they've got a directory of accredited lawyers. And the reason I'd encourage you to do that is that way you can be satisfied that you're getting advice from someone who's got real experience in clinical negligence. And specifically, though, in the area that we're talking about, I would encourage listeners to make sure that any lawyer they speak to has experience in maternal injury, perineal trauma, or OASI, which stands for Obstetric Anal Sphincter Injury cases, because that makes a real difference. The other thing I would say is do it sooner rather than later, because there is a legal time limit, and that's usually 3 years from the date of injury. But you can sometimes have what we call date of knowledge arguments. So if you didn't find out that you actually had an injury or an avoidable injury until much later, it can be argued that the 3-year clock should start at a later date. But to err on the side of caution, I would usually recommend that, the 3 years runs from the date of the birth. Finally, what I'd say is getting legal advice doesn't always mean that you are suing. What it means to start with is that you are simply seeking clarity from somebody who knows the system. Lots of women come to us, Theo, and I've had conversations with people where they simply just want some reassurance in relation to a complaint response they've received or an investigation that's done by the hospital. And we offer lots of free advice, and that doesn't always mean that we will be progressing a claim. It's just providing further reassurance to a woman who just wants to ensure that she's been given satisfactory answers.
That's incredibly helpful. And for anyone listening to the show who's panicking that they don't have a pen, don't worry, all of these links you'll find in the show notes today, and you'll be able to click on the hyperlinks. And that's incredibly practical and useful information. And that leads me on to ask one of my final questions that I ask every guest on the show, which is there, both of you, a particular resource that you'd like to signpost affected families listening to today too, that has helped you and you think would help possibly them? And Ailsa, I'll come to you first.
I think I've already mentioned MASIC, and it deserves another mention again, because it is the only charity in the UK, I believe, who specialises specifically in anal sphincter injuries for women who had birthing injuries. I think they just have such an amount of knowledge, both on their website and also because of who is involved in their board as well. They have so many different specialist medical professionals and also experienced mums. And if someone doesn't know where to turn to if they've had an obstetric anal sphincter injury, I'd say that is the first port of call, is to have a look on their website and to make contact with them.
Well, I'm so pleased that you mentioned MASIC because I'm actually a patron of the charity. And I've said this point before on earlier episodes, but I'll say it again. For anyone listening today who thinks that you might have similar symptoms, please do ask for help. Let's break the stigma and the taboo by talking about this and saying this is a really difficult and uncomfortable subject, talking about birth injuries and birth trauma, but there are so many wonderful organisations that can help you. So do pick up the phone or, recommend this to friends that you think are suffering too. And Leena, what would you like to signpost families to?
So I'd echo Ailsa's recommendation for MASIC, and I would also add, as I mentioned, birthrights, because that's a really good resource for anybody wanting to understand their legal rights and information. Action Against Medical Accidents, shortened to AVMA, that I just mentioned again. So they're an independent patient justice charity supporting people affected by medical accidents, and they offer a free helpline, advice on how to complain, what to expect if exploring legal action, lots and lots of free resources on their website, as well as a list of accredited specialists in that area. And then I mentioned APL as well, which was the Association of Personal Injury Lawyers.
That's a really helpful list for people to have. And we're coming to the end of the episode. And if I could both put you on the hot seat for a minute on politics. As a former politician, I am aware that there are people in Number 10 and MPs and others who are listening to the show. So I always like to ask everybody, what is the one thing that you'd like the government to do to improve maternity care? And perhaps, Leena, I could start with you.
Sure. So I would ask for the creation of a national standardized pathway for recognizing, managing and following up on perineal injuries, with mandatory postnatal reviews and access to trauma-informed care for every woman affected. As we heard from Ailsa, right now I think too many women are falling through the cracks. There's no joined up care between obstetrics, surgery and mental health, and I see too many examples of women not being informed about the severity of their injury or not being offered timely repair or psychological support. And that has to change. And then from a legal perspective, I'd also call for a culture shift, one where accountability is seen not as a threat, but as a way to rebuild trust. So we need transparency, not defensiveness. And I think listening to women is not a risk, it's a responsibility. And I think true change will come when we centre the voices of women who've been through it, which is what your podcast is all about, Theo, and demand care that's dignified, transparent and accountable.
Right, so that's a very good summary of the Birth Trauma Inquiry report. And the reason I called it Listen to Mums, Ending the Postcode Lottery and Perinatal Care was for all the reasons that you just outlined, that we need to have a standardised care package for mums who've had birth complications. And Ailsa, if you could say one thing to the Prime Minister or the Health Secretary today, what would you like them to know?
So I really do think that politicians need to take birth trauma and injuries seriously. I can't even imagine the financial cost it takes to mop up these injuries, lost careers, working hours, clinical negligence claims. It must just be a huge financial burden on the economy. I echo what Leena says, that everyone who suffers a birth trauma needs to have access to evidence-based pathway for their care. We shouldn't have to be working these things out as a woman who's in an incredibly vulnerable place in their life. Also, just to point out that although my injury happened in England, I now I'm back living in my home country of Scotland, and healthcare is obviously devolved here. So I've had a little bit of a look and a bit of an email with Kate Forbes, Deputy First Minister, around what is happening here. She herself also spoke out after she had a traumatic birth and suffered from postnatal depression. So in Scotland, there was a new pathway for maternal care, which was published in February this year. But I have to say, it has very little mention of perineal trauma and tears. And I'm aware that there's going to be some new maternity standards that are due to be published in spring 2026. So I really would love to work with the Scottish Government to ensure that tears are included. And something we haven't mentioned yet is that the Royal College of Obstetricians and Gynecologists have published guidelines, and they do have a obstetric anal sphincter injury care bundle, and that outlines the gold standard, and that needs to be ensured across the UK that every single health board and NHS trust is following that guideline.
Well, you make such an important point there about the devolved nations. And when I was an MP in Parliament, we successfully persuaded the government to roll out the OASI care bundle to all hospital trusts in England, not just in their original pilot hospitals, as a result of our cross-party campaign. But I keep making this point to government that that's only for NHS England services at the time. It did not include Wales, Scotland and Northern Ireland. And we've seen in the last few weeks, the Health Secretary has announced the latest plans he has on maternity. And I'm very much hoping that in December, when he reports back on the review that they're doing of all the maternity inquiries that were done, like my own, Don Rockenden's and Failing Hospital Trust, the CQC and others, that they will include something on birth injuries. So rest assured, Ailsa, myself and all the other campaigners will keep making that point to the government, and let's hope they do that in December. Well, can I thank you both so much for coming on today's episode? I think it's so important that we hear firsthand from mums like you what it's like to live with birth trauma and to have to deal with the very significant birth injury challenges and mental health symptoms that you had. And Leena, thank you for the really practical advice, I think, as well, for families listening to the show of where to seek help. So if you've enjoyed today's episode of Breaking the Taboo, then please do rate us on iTunes or Spotify. Please do share this episode with friends and family. We want as many people as possible to get access to the help and the care that they need. So thank you for joining us on Breaking the Taboo, and stay tuned for next week's episode. Bye-bye for now.